So today we're going to look at Chapter 2, which deals with the personnel and procedures of special education. So there are many professionals that support children with disabilities. Some of them are all types of special education teachers, such as itinerant, meaning if you can think of it just almost like I don't want to say half time, but they might do things like pulling a child out for a little bit or co-teaching with a general education teacher. There's bilingual special educators, and there's those special educators that deal with the 0 to 5 population. There's also other professionals that support children with disabilities. The school psychologist is very much involved in terms of testing and counseling. The school counselor might provide counseling services and certainly career option work. The social worker could be involved from both inside the school as well as an outside agency, a school nurse if the child needs it, and some type of interpreter. There are certain professionals that by law need to be part of the multidisciplinary team for a child, and one of those is the general education teacher. And even if the child is in special education more full-time, they will have general education teachers for things like art and phys ed, and so a general education teacher is always part of the multidisciplinary team. Some children may need aides, or what's referred to as paraeducators. For some children, that's important. By law, parents must be part of the multidisciplinary team or a legal guardian if for some reason the child does not have a parent that's involved. There's some other specialized service providers such as adaptive physical educators, orientation and mobility specialists for children who are visually impaired or blind, and there's a whole not a whole lot, but a number of therapists, such as physical or occupation or speech, and audiologists. In terms of intervention and assistance, we're looking at a number of different things. So there's always a team of professionals. Now, for some children, that team could be very small, just the required people involved as part of the team, or it could be quite large if a child has significant disabilities. The goal is always to help the child to gain as much access to general ed as to the maximum extent appropriate. The team is always involved in collecting data and formulating ideas to support the child. School funding is involved sometimes for further supports, and there's always dates set to review the students' data to see how they're doing. Response to intervention is not part of the special education system. However, you always see it in special education textbooks as well as hear about it in special education classes. And the reason for this is that it's based on the philosophy and principles that are to support the child to perhaps prevent special education. So if you remember from last chapter, it's a 3-tiered system that uses research-based or evidence-based interventions that will help the child. And then if the child's not responding at tier 1, we move to tier 2, which is more higher level of intervention and time. And then tier 3, we might be looking at referral to special education. But the professionals are gathering data, they're using interventions, and they're trying to address the child's needs. And they're continuing to monitor that data. If we have to screen, and school districts are required to, by law, to do certain types of screening, such as visual screening and hearing screening, but there might be additional screening carried out by professionals, and that's when we suspect the child may have a disability. So there's initial screening, and then there may be further evaluation, but the screening would involve such things as really looking at the problem or challenges, reviewing records, and any further testing or initial assessment or screens. And certainly carried out before we would move to a special education referral. Referral could be for further evaluation, or maybe we've done that already, and it can be for actual special education. The multidisciplinary team is always involved. Parents are part of that team. Parents will be informed of their rights, but they also have to give permission for this further step of evaluation after a screening. So if they do not, we cannot move forward as a team and provide special education unless the parents give this permission, the child would remain in general education full-time without the special education program and supports. So assessments need to be done in all suspected areas of disability. So we have to be very clear on that if the reading's a problem, to give thorough assessment in the area of reading and math, anything related to behavioral or social functioning, intellectual functioning, and any additional medical areas as well. We have to pay attention to the child's history. In terms of testing and assessing, they must be non-discriminatory in nature, and that means we have to be aware of a child's race, their culture, and their language. Instruments that we use have to be valid and reliable, meaning they have to measure what it is they set out to measure, and they have to be done by trained professionals, teachers being one set of trained professionals. So you'll be doing your own observations and testing of the child. They have to be take into account all suspected areas of disability and in the language that the child is most comfortable with. And we have to use a variety of tools. We can't just use one before we label a child. And so the decision to place a child in special education is a very, very careful, thought out decision that has a set timeline to it from the evaluation to the actual development of that IEP. But after this full evaluation, that will, we're asking the question, does the child have a disability? Now, the child could have a disability, but that disability maybe doesn't affect the child's education. And so the question we need to ask is, does the disability adversely affect a child's educational performance? And so if the child's educational performance is impacted, the child will need that specially designed instruction and or related services. And we have to really thoroughly look at whether the child's needs can be addressed in special education. So when the child is eligible for special ed, the child will receive an IEP, or Individualized Education Plan or Program. And the other decision is, the IEP is one decision, and that's very well crafted and has components by law that we have to address in that actual plan. But the other decision is where this plan will be implemented in the child's least restrictive environment. So where will we implement this plan for the child? And for many children, that's the general education setting. The IEP is monitored on a on a yearly basis. Okay, so that's by law, but we're updating the students' functioning, meaning their present level of academic and functional performance. We're reviewing their progress and setting the goals for next year. But the IEP is not a static document, and it can be changed throughout the year before that annual review date. For our monitoring, we're really looking at, does the student need to be reassessed in certain areas or in all areas? Does the student still even need special education? And we need to note that the parent permission is not required for re-eval, only for that initial evaluation. By law, for most students, it's a 3-year re-evaluation, but in Pennsylvania, for children with intellectual disabilities, it's a 2-year re-evaluation. The law states that we can give more, but we can't give less. All right, so 2 years is more, it's not less. Members of the IEP team, there are many, and again, depending on the child, will depend on how many team members they have, but it's important to note that by law, the minimum number of team members would include the parents, a special education teacher, a general education teacher, and a district representative. And the district representative could be a supervisor of special education, a principal or vice principal, but it's someone who can speak to the district's resources. I should say, go back to this slide, for some children also, a psychologist always has to be involved. What are the required components of this plan? Well, we have to have on this plan the present levels of the child's academic and functional performance, annual goals, and for some children we'll have short-term objectives, meaning they're like shorter goals with criteria that keep us moving towards this annual goal. the specially designed instruction the child will receive and any related services, whether or not the child will have supplementary aids and services, assistive technology the child might have, the extent to which the child will be with non-disabled peers, and how the child will participate in state and district testing, which testing, with what accommodations the child will need, will all be on the IEP directly. Additional components of the IEP include the dates of the services and the locations. For example, a therapy such as speech-language pathology services might be for 30 minutes a week in the speech-language pathology room. Where this program is going to take place is important, and whether or not we need to have a transition plan for the child. So the federal law says we begin transition services at around age 14. In Pennsylvania, at age 16, we have to have the transition plan fully attached to the IEP. The age at which the child will reach majority, how progress is going to be measured and reported to parents, and any other considerations we may have. The least restrictive environment, again, this decision placement is made for children, and there's a continuum. The law says the district has to have a continuum of placements to choose from. Again, for most children, it's the general education classroom. For some children, it could be general education classroom, but they might be pulled out for a bit to go into a resource class. For some children, they'll be in a separate class with all children with disabilities, and for some, the most appropriate, least restrictive environment could be a separate school or a residential school or some type of other placement such as home or a hospital, or even some children are incarcerated, so they need to have an IEP wherever they are. The law builds in, sometimes as team members we disagree. And so the law has built in very specific rules around how are these disagreements resolved. There's always, if there's going to be a filing for a due process hearing, number 3, there's always a dispute resolution session unless both parties waive it. There's mediation, and parents and districts could choose to go to mediation. Or there's a formal process, much like a court, referred to as a due process hearing. The issues we find still related to special education professionals and procedures is that in most parts of the country we still have a strong shortage of special education teachers, not just in urban environments but also in rural environments as well. And response to intervention, although we are seeing great research come from this, it still requires that people know what they're doing, that there's valid implementation of the interventions by general education, because that's where this takes place, and documentation impact of research-based practices that need to be used. And that concludes Chapter 2.